Hi, everybody. I hope you're all doing well. I was thinking about what I would like to talk to in today's video, and what I've chosen is to discuss the idea of clinical trials and make sure that everybody out there was aware of what they had access to potentially participate in. I was a participant in a type 1 diabetes clinical trial myself. My involvement just ended about a month ago. I was in it really since the beginning of my diagnosis. When I got diagnosed, I can remember looking for answers, looking for anything that would allow me to learn more and become involved as soon as I got diagnosed. Now, when you're typically first diagnosed, you have different markers inside of your body. So your body's typically producing different amounts of insulin than I am now. And that's just natural progression. There's that honeymoon phase where you sort of start off at a certain level and your body, your pancreas declines over time. And a lot of these studies will look for people in different categories of that journey because they're testing different things. Now, in my case, the study was a phase 1 clinical trial, and they were looking for adults to see if they could basically extend the honeymoon period. I think the goal was to sort of retrain the immune system to not continue to kill the beta cells. And so I think the theory would be that if you take somebody that's in the honeymoon phase or that has some residual pancreatic function in the beginning, that if this medication could make that part last a little bit longer, that in theory, they would need less insulin over time. Now, my trial was a double-blind trial, so I don't actually know if I received the medication. However, every time I got the injection, I got very sick. And it's kind of hard for me to believe that they would give a placebo that could make people so sick. So I think I got it. And I think I'm doing very well with my management, although it's difficult for me to know if it's because of the medication or just my behaviors and my habits and things like that, or maybe a combination. But it's either way, the actual goal of my study is not really, it's not to benefit me personally. The actual goal is to create a vaccine. So I think what they're hoping is that if they see enough progress here, they can increase the strength of the medication that I received for future cohorts. So like in a phase 2 trial, I think they would make the medication stronger and so forth. In a phase 3, the goal would ultimately be if they could figure out how to extend the honeymoon indefinitely, to then give it preventatively and stop that immune attack from ever happening. So it's really exciting stuff. And I had a great experience because the people that I spoke with at the clinical trial, they all had type 1 diabetes. So they understood my concerns and my stresses about dealing with the management in a much more deep way than, my endocrinologist, who does not have diabetes, and also my educator. And they're just very involved. So it was a great scene to be a part of. I learned so much from it. I benefited a ton from it. And it also just feels good to help out. So I know that there's all sorts of studies for all sorts of different ages and categories and conditions and, stages of progression of the condition. So I wanted to make sure that you all were aware of how to see them because it's a pretty cool tool. And I'm going to share my screen just to make sure that, again, you all know how to look at this. I think what I would recommend is that everybody who has even the slightest bit of interest go to this website, put in the parameters that are relevant to you, and see if there's any trials that you qualify for and that you're interested in. Not only do most of them reimburse you for your time, some of them will even pay you. Mine did not pay me. Mine reimbursed me, but I did spend a lot of money going. Mine was in Colorado when I lived in New Jersey, so there was a lot of travel involved in mine. Like I actually went there probably, I don't know, 10 to 15 times over the course of 2 years. However, I got reimbursed, so it ended up not costing me anything. And I know that you don't have to do, you don't have to travel for a study. Part of the filters will let you pick where you want to go. Some of them are telehealth. And again, most of them will tell you if they're going to reimburse you or pay you. So it can not only benefit you personally, it could benefit the community because research is important. So the more people that they have to participate in these studies, the faster things can come to market. And so you may benefit from the medication in the study itself, which is a really cool thing. You might be getting something that's not going to be publicly available for years. So you can potentially really benefit from that. You can help the community and you can maybe even make some money. And it's just a fun experience. So anyway, let me share my screen and I will just show the website that we are going to review. So the website it's the official government site, so clinicaltrials.gov. And so if you go to Google and you just do a search for the 2 words of clinical trials, it's going to be the first word or the first result, I'm sorry, clinicaltrials.gov. So if I click on this website right here, we're going to be at the overall clinicaltrials.gov website. Now, this is not specific to diabetes website. This is just all clinical trials. So you want to really use the search filters here. Now, I am going to do in my search, I'm going to start off with just a basic search and I will do type 1 diabetes. I'm going to just choose this first pop-up option that comes, and I'm not going to drill down into any location parameters or anything like that just yet. So let's just do a basic search. There are 4,000 available studies right now. And so this is just type 1. Now, type 2 probably has 100 times more than this. So if you have any type of diabetes, recommend coming here, filling it out to start with. Start with the general search, see what you see, and then work your way down from there. Now, this is obviously too many studies to even look through and really get a feel for what I might be interested in or what I might be qualified for. So I'm going to use some of these filters to pare that down. So you can do location. I'm actually not going to do location right now. I'm going to just put in sort of like my my eligibility criteria. So I'll do male, adult. I will do, you can even pick the phase of the trial. You know, like I said, my study was phase 1. So early phase 1 and phase 1, if you're maybe afraid of some of like the potential side effects of a study, I think it's a little bit more risky in these early phase because these are typically known as like, I think, safety trials. So they're really trying to determine if a medication is safe before really giving you a really strong dose and then bringing it to a larger group of people. So if you're looking for something that's maybe a little bit more proven, you might want to look at a phase 2 or a phase 3. Honestly, I don't even know what a phase 4 is, but anyway, I'm just going to apply those basic filters with my age and all that kind of stuff. So here we actually are seeing studies that are even completed. So I'm going to update that. What we want to look at is studies that are actively recruited. They are not completed. So I want to go apply that filter. So now these are all studies that are actively recruiting, which means the researchers are looking for people to be in these studies. And so you can see with my parameters, there's still 356 studies that I could participate in. So if I just briefly look at these, you can get an overview of sort of where they are. You can see this one's in Florida, California. Let's look at this one. So this one's in Denmark, but the name of the study is Video Consultations in Type 1 Diabetes Treated with Insulin Pumps in the Outpatient Clinic. If you click into it, you'll get like a full overview of that study. See these tabs here. So researchers, if there's any results that are posted so far, but you can get a really good feel for what they're doing. And I think it's just interesting to look at this stuff. So let's see. So this particular study is sort of, it looks like they're evaluating the effectiveness of telemedicine in like an outpatient setting to help you understand your type 1 diabetes. So let's just say you are somebody that uses an insulin pump and maybe does get your treatment through an outpatient clinic and you're not satisfied with the level of information or guidance that you got. I personally would look into the study. I would submit my information, because what typically would happen is when you're doing a study, the people that are involved they're really involved. You know, you're not going to be pushed out of there quickly like you might be at a regular physician visit. These people are going to want to interact with you in like a very deep way so that they can get all of the data that they can out of you. And so you as an individual can really use this to your advantage, because it's your chance to get all of the answers and the support that you've probably always wanted from a dedicated team. And that's, I think, the biggest thing that goes missed in terms of not participating in these studies. Like, not only is it a study, but think of it as your chance to speak with absolute experts who are, their sole focus at this point is to pull as much data and get to know you as deeply as they possibly can. And so this is your chance essentially to get like free healthcare. And I think that's something that really needs to be stressed. So you could, again, if you're interested in studies, they oftentimes will provide contact information. So for this one, you would basically just email this user, or you could call this number. I have no idea how international numbers work, but this is exactly what I did for mine. I called them. The number went straight to a research coordinator. I spoke to the research coordinator, and in like a couple of days, I had the paperwork sent to me that basically got the process started. So let's just see if there's anything else good here. So again, an online education program. I mean, how cool is that? So if you're somebody that maybe is not doing as well as you would like with your A1C, and maybe you have questions that you're not sure about, but you don't have the money to see a diabetes educator or somebody else, this is perfect. I mean, this study is going to actually give you an online education program for free. There's no way you're going to pay for this. In fact, you'll probably be reimbursed for it. So you're going to be getting all of this great guidance just so that your results can be used in a study. So I would encourage you very strongly to take a deep look into this. Again, whether it's type 1 diabetes, type 2 diabetes, gestational diabetes, or anything else, or even other conditions. Clinicaltrials.gov is a fantastic site because it can benefit you in addition to all of these other benefits, really. So remember that, like, look at this not only as or not as something scary in which you're going to be, submitting your body to science, you don't know what's going to happen. Read what's happening in the study. Think about if what they're trying to do works, how it would benefit you. That's the biggest thing I want to stress is you can get a ton of free information and help out of this that you cannot get through any other method. So please check that out. Good luck with everything. Let me know if you have any questions in the comments. Thank you.